We're joined now by Dr. Zorba Paster. His longtime Wisconsin public radio show ended last week due to some funding cuts, but he has a new podcast called Stay Well with Dr. Zorba Paster, and we welcome you to the program. And I know you've been doing this for decades in terms of really trying to take care not just of your patients, but people throughout the state that have questions. And that's why we wanted to speak to you to really try and understand how people are taking in this shutdown outside of Washington, D.C. We want to talk to people about where it's going to be felt most in communities, the communities like where you work and in Wisconsin. What have you been hearing, especially because healthcare seems to be at the very core of this dispute?
Well, healthcare is at the core. And part of the problem with healthcare is you've got all this noise in the system where people who really are not trained in healthcare, politicians, movie actors, they say Tylenol causes autism, which it does not by any means. All of a sudden they're in the system and people don't know where to turn. And that's the problem. The problem is they get confused because there's so much noise in the system.
And does that include the issue of health insurance right now and people just trying to figure out how do I get insurance? Is it going to change? Will my local hospital be funded?
You got it. Right. That's exactly it. Insurance is always an issue. And I'll give you a perfect example. If you get a colonoscopy for screening under Obamacare, it doesn't cost anything. If you get a colonoscopy because you have blood in your stool, all of a sudden you may be stuck with a $5,000 bill, which may be your copay because you didn't meet your deductible. So the way it's actually coded determines whether or not you actually have to pay money. And when you look at healthcare, that is the number one reason for bankruptcy in this country. It's absolutely awful. And with the federal shutdown and everything else, it's only going to get worse.
Yeah, it is real, that medical debt for so many people. Wisconsin representatives, right, from your state in Congress, they can't agree on the facts. Democratic demands, Republicans are saying it would mean that the Dems are fighting for Americans to pay for undocumented people to get medical care in the United States. The Dems are shooting back and saying, look, 4 million Americans will have their subsidized health care terminated. 22 million will have their premiums go up substantially. How is it playing out with the people that you're speaking with in terms of, they're going to have to renew a lot of their government insurance in the coming weeks?
That's exactly right. People are concerned. They're concerned about their deductibles. They're concerned about whether or not they're going to get insurance, because right now, of course, in October, November, that's when people look at this and they're worried about the premiums that are going up, because all of that is more likely to happen. And with the drop essentially in government subsidies, that's going to be a big difference in Wisconsin and across the country. And it's got people worried. And then they don't come in for their immunizations, they don't come in for their preventive care. And of course, that means they're not going to get the care that they need to keep everybody healthy.
Dr. Paster, how do you navigate, though, the partisan divide here? Because it is stark in terms of what is going to happen in the coming weeks.
It used to be that healthcare wasn't partisan. I mean, it used to be that healthcare was not a partisan issue, that basically it was something that simply both the Democrats and the Republicans agreed with. There wasn't any problem with that. I don't know who's a Democrat, who's a Republican when they come into my office. And so the problem is right now, you have people coming in with a different thought based on what they read and what they see. And it's a tremendous problem. It's very hard to navigate that. But the thing is, your healthcare provider who you trust turns out to be the one to give you the best information. And it's a matter now of trying to get that information from your healthcare provider, doctor, nurse practitioner, or PA.
And you are a healthcare provider. The cuts that are coming in the Republican budget, what's already been passed, right? Does it concern you?
Overall, yes, it does make a difference. We have an independent, we have a clinic. The clinic, it's not a government clinic. And so basically, as soon as things get cut, especially Medicaid, which is a very basic part of our clinic between Medicaid and Medicare, that's probably responsible for maybe 35 to 40% of the dollars that come in. And if that's cut, it's going to be much more difficult.
Well, we certainly have a great insight there from you, Dr. Paster. I really appreciate you joining us as we continue to see what happens with the shutdown.
Thanks for having me. Really appreciate it.